In January, your membership fees that you would pay to a direct primary care clinic can be paid pre-tax, which you asked me at the beginning, what's the biggest issue that holds everything back? And maybe we should just finish with this. I think if everyone listening to this, whether you're a patient or a doctor or a practitioner or whoever you are, you could recognize that the insurance companies and the pharmaceutical companies have way more control over medicine than they should. And ultimately, you might also agree with me that really the only two people that matter in medicine is the patient and the practitioner, right? Because the patient is actually the one who's the most important, patient-centered care. So in this legislation that comes out January 1st, basically insurance and pharma can both get kicked out at the same time. Because ultimately, if you're a practitioner and you are licensed to practice medicine in your state and you can have a direct relationship with a group of 400 patients, you can decide the standard of care. You don't take insurance and they can pay for it with pre-tax money. So it's a once in a generation opportunity to realign the finances of medicine, and primary care is the most important thing. If you have high quality primary care, the rest of the system, shrivels because you don't need as many of everything else that happens. It's really the most important thing. And so I think we have a once in a generation opportunity to transform medicine. But what it takes is practitioners and doctors to step into the responsibility for taking care of those 400 people directly. So this is a moment for all of us, and I think it's the most exciting legislation that's existed because it allows a situation to unbalance what has been horrifically unbalanced for generations, which is the control of pharmaceuticals and insurance over medicine.